The science behind magic mushrooms, which contain the psychoactive compound psilocybin, and LSD, lysergic acid diethylamide, revolves around how these substances interact with the brain and the central nervous system, resulting in altered perceptions, cognitive shifts, and the well-known psychedelic experiences associated with their use. Both psilocybin and LSD are psychedelic substances, which means they induce changes in consciousness and perception, often leading to altered sensory experiences, vivid hallucinations, changes in thought patterns, and emotional responses. While their effects are similar in many ways, they work through different mechanisms in the brain and produce distinct experiences. Here's a detailed breakdown of the science behind each. 1. Magic mushrooms, psilocybin. Chemical composition. Psilocybin is the primary psychoactive compound in magic mushrooms. When ingested, psilocybin is converted by the body into psilocin, the active compound that affects the brain. Psilocin is a serotonergic compound, meaning it influences the brain's serotonin system, particularly the serotonin 2A receptors, 5-HT2A receptors. Mechanism of action. Psilocin and serotonin. Psilocin mimics the action of serotonin, a neurotransmitter that regulates mood, perception, and cognition. When psilocin binds to the serotonin 2A receptors, it causes altered neural signaling, which leads to a disruption of normal perception and cognition. Increased brain connectivity. Psilocybin, through psilocin, increases connectivity between different regions of the brain that do not typically communicate with each other, especially between the default mode network, DMN, and other areas. The DMN is active during self-referential thinking, such as daydreaming, mind-wandering, and introspection. Psilocybin temporarily reduces the activity of the DMN, which is thought to contribute to the feeling of ego dissolution and the experience of interconnectedness. Disrupted sensory processing. The altered connectivity between brain regions also leads to the hallucinogenic effects of psilocybin. The brain's processing of sensory input becomes mixed up, resulting in visual and auditory hallucinations, synesthesia, blending of the senses, and changes in the perception of time and space. Psychological effects. Ego dissolution. One of the hallmark effects of psilocybin is the sense of ego dissolution, or a feeling that the boundaries between the self and the world dissolve. This can lead to a sense of unity with nature or the universe. Visual and auditory hallucinations. Colors may appear brighter, patterns may seem to move, and sounds may be distorted. Some individuals report seeing geometric shapes, fractals, or vivid imagery. Emotional shifts. Psilocybin can induce intense emotional experiences, ranging from feelings of joy, awe, and interconnectedness to anxiety, confusion, and fear. The experience is highly subjective and can be influenced by the individual's mindset and the environment in which they take the substance, often referred to as set and setting. Therapeutic potential. Recent research has shown that psilocybin may have therapeutic effects for various mental health conditions, such as depression, anxiety, and PTSD. Studies suggest that psilocybin, when used in a controlled, therapeutic setting, can help patients achieve profound emotional insights, foster new perspectives, and reduce the severity of these conditions. 2. LSD, lysergic acid diethylamide. Chemical composition. LSD is a semisynthetic compound derived from ergot alkaloids, which are naturally found in the ergot fungus that grows on rye. It is a potent serotonergic drug that primarily affects the serotonin system, but also interacts with other neurotransmitter systems in the brain. Mechanism of action. LSD and serotonin receptors. Like psilocybin, LSD acts primarily by agonizing the 5-HT2A receptors in the brain, which leads to altered sensory perception and cognition. However, LSD has a much broader range of interactions with various serotonin receptor subtypes and other receptors in the brain, which may contribute to its more complex and sometimes unpredictable effects. Increased brain connectivity and disruption of networks. LSD increases connectivity between different regions of the brain, similar to psilocybin. This is thought to result in an overload of sensory information, causing distortions in perception, enhanced sensory input, and hallucinations. Reduced default mode network activity, LSD, like psilocybin, reduces the activity of the default mode network, DMN. This contributes to the feeling of ego dissolution and altered self-awareness, although LSD's effects on the DMN may be more pronounced and long-lasting compared to psilocybin. Psychological effects. Altered perception of time and space. One of the most common effects of LSD is the distortion of time, where minutes may feel like hours, or time may seem to slow down or speed up. Similarly, spatial awareness may change, and individuals may feel like they are in multiple places at once or experiencing a shift in the structure of reality. Visual and auditory hallucinations. LSD is known for producing vivid visual hallucinations. Common effects include seeing geometric shapes, colors, or patterns, with some users reporting intricate and dynamic visual experiences. Auditory hallucinations may also occur. Intense emotional shifts. LSD can lead to intense emotional experiences. Users may feel profound feelings of connection, awe, and enlightenment, but also anxiety, fear, or paranoia, especially if the experience becomes overwhelming. Like psilocybin, the environment and mindset of the user play a crucial role in determining the nature of the experience. Therapeutic potential. Like psilocybin, LSD has been researched for its potential to treat various mental health issues, such as depression, anxiety, and substance abuse disorders. LSD-assisted therapy, in combination with psychotherapy, has shown promising results, particularly in the context of end-of-life anxiety in cancer patients and addiction treatment. Comparing psilocybin, magic mushrooms, and LSD. While both psilocybin and LSD belong to the class of psychedelics and share many similarities in their effects, there are also some important differences. Duration of action. LSD has a much longer duration of action compared to psilocybin. A typical LSD trip can last anywhere from 8 to 12 hours, whereas psilocybin's effects typically last 4 to 6 hours. Intensity in visuals. LSD tends to produce more intense, complex, and vivid visual hallucinations, while psilocybin experiences may be more subtle and introspective. Some people find LSD to be more stimulating, while psilocybin may feel more grounding or spiritual. Side effects. Both substances can cause side effects such as anxiety, nausea, or confusion, especially if the user is not in a supportive environment. LSD may cause more pronounced physiological effects, like increased heart rate or body temperature, while psilocybin generally has fewer physical side effects. Conclusion. The science behind magic mushrooms, psilocybin, and LSD centers on their ability to alter brain chemistry, particularly through their interaction with the serotonin system, leading to altered perceptions, emotions, and consciousness. Both substances show promise in terms of therapeutic applications, particularly in mental health treatment, and they are being increasingly studied for their potential benefits. However, the experience of using these substances can vary widely depending on the individual and the environment in which they are consumed, and caution is advised when considering their use.